For instance, we wouldn't expect somebody to show up naked to begin with coming into the examination room. That might be concerning for, let's say, in the psychiatry realm for active.
That could be a problem.
Similar to doctors and medical professionals, it's what's expected in that situation. Interestingly, for females who are wearing, let's say, a business outfit and a white coat, they're more often confused for medical assistants or nurses.
I remember in medical school, how to take a history from a patient, like here's all the questions you ask. We kind of, I think in our own way, learned, well, how do you connect with people? You're in this white, sterile environment many times. The room is cold. The doc's wearing a real stiff white coat, and they come in all hurried. I can be in the middle of a deep conversation with somebody about a life-changing diagnosis, and literally they'll look at my socks and they'll be like, what is that? Is that a duck? I've realized it creates this air of realness.
Trust, ultimately, is the foundation that's needed if we're then going to be able to move forward with understanding and then finding a way forward for medical treatment, for health, and for well-being. I'm Dr. Laura Sidari, board-certified psychiatrist.
And I'm Dr. Tony Sidari, board-certified rheumatologist.
And welcome to our podcast, No Cure for This, giving you what to say for medicine and life when you have something you can't fix. And all you can do is cope, adapt, laugh, and keep showing up. We're here for the stuff that isn't a guideline. We'll talk about burnout, stress, relationships, and everything in between.
Although our work as physicians informs these discussions, this podcast is not for treatment purposes, and any descriptions of patient situations have been modified to protect confidentiality. For any direct medical advice or treatment needs, we recommend you seek the care of your healthcare provider.
What do you have to share a little bit about the evolution of your socks?
So at some point, the socks became a bit of a living entity in and of themselves. There was a day that I was getting ready to go see a patient, and my nurse came out, and she said, patient's doing great, everything's good, but then she asked me what socks you're wearing. And I'm like, what socks I'm wearing? Like, what does that have to do with anything? And so it turns out that this very short into, being out of the military into our current practice environment, I guess it had been noted that I had interesting patterned socks, and it was, for better or worse, all the conversation of some particular cute little old lady organizations, of which all of them knew me, and they talked about my socks. It's kind of become this thing where I notice somebody might randomly in a day see whatever pattern I have. So today, for instance, I have my campfires and skis. A little out of season.
I always thought they were s'mores. I didn't realize they were skis.
Oh yeah, they're definitely skis. But the point being, I can be in the middle of a deep conversation with somebody about a life-changing diagnosis, and literally they'll look at my socks and they'll be like, what is that? Is that a duck or an elephant? I'm like, actually, no, it's actually a surfboard. And it almost creates this, I've realized it creates this air of realness. We're talking about the socks, and in the midst of this very cold medical interview, which really a lot of times it can feel that way and really is. You're in this white, sterile environment many times. The room is cold. The doc's wearing a real stiff white coat, and they come in all hurried because oftentimes we're running behind. And, it's just this very sterile feeling environment. And there's different things that I think we've both learned, not just the socks, that turn that into a more human interaction. And so I remember in medical school, while we were, say, learning how to take a history from a patient, like here's all the questions you ask, we kind of, I think in our own way, learned, well, how do you connect with people? So in Buffalo, when we were in medical school, and as a member of Bill's Mafia myself, If you see somebody wearing Bills clothes, I don't care what they're there for. They could be in the ER with pneumonia. I'm going to say go Bills. Like immediately they know, we're on the same team. If they're wearing a different team's thing, I'm probably going to slip in there somewhere. I'm a Bills fan, but hey, I'm okay with your team too.
I have to throw in there too. I'm pretty sure you have some socks with like Josh Allen's face on them.
Got my Josh Allen's. I
There's
got my St. Patty's Day Go Bills.
Oh
Luck
gosh,
of the
that's right.
Irish, which is it's an interesting intersection of themes, but I only wear them around St. Patty's Day, or maybe playoff games.
Your mom, I think, has the best selection of the Bills socks as a true Bills fan too.
So, we had experiences like that, say in Buffalo as an example. And when we lived in San Antonio in Texas, folks in Texas have some of my favorite, most endearing local vernacular, including us finally picking up the y'all phrase. Y'all is about the most kind way to address a group of people as opposed to, what we all grew up with in Western New York, which is, hey, you guys, It only took me a few years to pick up y'all. So now I still do it. And people kind of look at me funny because we're in New York. Are there ones that you feel like you've picked up as well?
The other one that I remember you sharing with me was about working with a dermatologist in Buffalo and sharing a little bit about how he relates to his patients and even sort of some of the things he puts in his notes. Could you share about that?
He was the person I learned that, when you're talking about, being relatable to each other as we're going through like a medical interview, he basically considered somebody's what we would call the social history, which is like, what's your job? Who do you work for? Do you have your own business? Like, what's your family setup? He wanted to know that information. When I would present to him as a medical student, he wanted to know that before I even said the diagnosis. Like, why is the patient here? So it would be like, this patient is so-and-so. They own the mobile at the corner of XYZ Road. They're here to follow up their melanoma. And, they have this terrible diagnosis that they're monitoring, and it's a terrifying visit. He come in the room and would say, hey, how's that gas station going? Like, what's been new? Oh, business is good. Yeah, I stopped by the other day for XYZ. We had to pick something up, and he would just get in this conversation, and then he would dive into the meat, which is like, okay, listen, we got to do your PET scan. We got to do this. I mean, it's pretty intense stuff. And that's how he made it more real.
And those are the kind of things I've picked up too in psychiatry, that getting to know these pieces of folks that I work with and what matters to them, and making sure that I'm thinking about that and making that an active part of when we're having a conversation. In psychiatry, I tend not to wear fancy socks or like kind of things that will draw as much attention.
One question about psychiatry, maybe you can answer this. I mean, every TV show we saw this on The Pit. We saw this in that one where Steve Carell's a psychiatrist or psychologist. It's actually kind of uncertain. Sometimes it seems like they confuse the two. Sorry. Does everybody get in training like a cardigan sweater with an Argyle pattern? Is that like a standard?
I feel like that, and also wearing glasses are sort of like the standard uniform for a psychiatrist. But I think for psychiatry, having comfortable but semi-formal clothes are things that I've kind of leaned into. And I really try to make that about the questions that I ask in the conversation to not distract from those things that people are coming in for. I also, on the patient side, I'm never surprised about different ways that people dress, show up, their cultural preferences. And so I think having a more neutral palette where I'm coming in and I'm not distracting from that. It's just been my style as I meet with people. It's interesting because there's been evolution with that. So there's a 2025 BJM article that talks about sort of the updated standards of what would be acceptable for professional dress. And I think it's less about what you do or what you don't in terms of wear this and not this. Because really our conversation here is not about, you should do this or not this very, very concretely. But what it shared was extremes are oftentimes not seen as acceptable. So if you're overly casual, or you're overly very tightly dressed. So for instance, wearing like a tuxedo probably is not the best way to show up in a medical encounter. And what resonated related to professional dress is expectations. So even setting specific components, like if you're in more of a hospital setting, scrubs are more acceptable versus if you're in an outpatient specialty environment, having semi-formal or kind of business casual dress. A white coat is something that is seen as, for medical field, really important. But interestingly, for females who are wearing, let's say, a business outfit and a white coat, there's some studies to show they're more often confused for medical assistants or nurses. So part of this is thinking about what are others expecting when we're coming in and what are we expecting of them. The best way to know that is by receiving feedback. So, for your patients, for instance, what's some of the feedback that you've gotten over the years related to your socks?
Well, I've never gotten negative feedback, so that's a start. It's really a conversation starter that it breaks the ice a little bit. People are coming in with these with different fears about things, with diagnosis and treatment and all these things, and then all of a sudden, we get this little bit of break in the ice. So when you feel that, I think you have to lean into it a little bit, which, for better or worse, I guess I have, and or the staff I work with have over the years, with all the gifts of socks have gotten, for better or worse. But it's like, at the same time, I think being receptive to if there's a perception of overdoing it. So it's kind of reading that room and then sort of having that feel for how does that seem to impact my entire encounter with somebody. But at the end of the day, it's so important to not have it be like contrived, like the sock thing was not manufactured. I kind of fell into it. And now, fortunately, it's just become a thing. It's its own living being. And I'm just following it along.
I think that's one of the key points, that it is organic. It's something that, to begin with, may not be intentional, but over time you receive that feedback from others and it sort of evolves into its own thing.
I think it's also important to consider, like, how, even more important than some of these visual factors, ways that we might come off as being warm as opposed to very cold, in our, like, just interaction with somebody. Everything from the cadence of our voice to tonality. If I'm like really high voice and you can tell I'm real tense in my throat and I'm just kind of like stiff, you're not going to feel relaxed to talk to me. You're not going to feel like you want to tell me, you might not want to burden me with all your problems. You might feel like I can't tell this person all this stuff, or may just make you feel uncomfortable, or you might just not come back.
That's something that plays out in the research. So in fact, when we look at different factors that facilitate communication or get in the way, a smile in alignment with oneself and really warm, what those studies showed is there was no difference that played out in terms of wardrobe and in terms of impact. So we want to think about that this is one part, or this is one component of how we're building our relationship with our patients. And it's less about, do you do this or you do that, but more so leaning into what's the feedback that you're getting? How is that being received? I think also there's a little bit of that dynamic with your staff that I've noticed evolve too. It seems almost like a competition to see who could come up with the best socks.
There are certain members of the staff that I work with who, if they go on a trip, they probably went out of their way to find me some fun, fancy socks. Like, last trip that one of our nurses took, she made sure she stopped. They were at a record store. She got me a pair of socks that was from one of my favorite, unbeknownst to her, Strokes albums. And I'm like, these socks are amazing. And she thought that I wouldn't even know. She didn't even know if I would know what they were. She just thought they looked cool. I'm like, well, actually, I think they're quite fun.
What also leads to socks that don't make the cut? So I've noticed there's some that just never seem to leave the drawer. How have you come to those?
With you being kind of we'll call it the drawer overseer, you probably noticed there's certain socks with wear patterns, and there's certain socks that don't have wear patterns. The ones you're going to find that obviously in a medical environment, I'm not wearing day to day and probably never would, not even probably, are, for instance, a pair of socks that have whiskey glasses and cigars on them. Probably should not be counseling somebody about their alcohol intake or their smoking and be wearing socks that are promoting. I have a pair of socks from when we lived in San Antonio, Day of the Dead and everything, has skulls on them. Probably not going to wear those to work. Just saying, if you see a doctor with skulls on them, probably turn around and head back out that door.
I think that's a
Context based.
yes. So when we're thinking about how we show up, and one of the ways that we show up is what we wear, that context matters. And so thinking about what is the purpose of what I'm wearing? At first, it's very much organic, this experience with the socks and relationship with your patients and with your staff was not developed in sort of this piece of, well, I need to find something that is going to reflect my personality. It sort of just evolved. And that emphasis on it doesn't take away from that relationship. It's not like a distraction. It's something that is facilitating that connection.
I mean, I think that's of the important points with the whole piece about socks and wardrobe and like even just how we approach that that encounter from like a warmth perspective. It's like not manufacturing things like, well, I'm just going to smile at everybody. Well, that can come off as creepy. If it's inappropriate smiling, like it's like people are not going to respond well to that. And in fact, I've known people who saw certain doctors that was the case. And it may just be that they don't know how to do an appropriate social smile. And that's okay. But somewhere along the way, they learned that that's what they were supposed to do. Similarly, it's like, well, where can we start? If I'm fresh or I'm trying to sort of revamp my entire approach, like where do I start?
I think it starts with getting curious about what people respond well to. So we don't have to get it right the first time. But if you're getting that feedback, like, hey, I really love your socks, that's sort of how that evolved. Similarly, I really like how you do this or how you do that. That patient role is so important. So a huge part of developing our style and how we show up comes from that feedback that we get from our patients. And so if somebody says, I really like how you did that, that can help us to reinforce, this is how I can show up in a way that's helpful. This is how I can show up in a way that feels aligned with oneself and who I am authentically. And most importantly, this is how I can show up in a way that's helpful for my patient getting their needs met and feeling like they can share these really vulnerable and sensitive experiences that are so important for us to be able to find a way forward.
And we've covered a lot on the doctor and practitioner side. What about for patients or, people on that other end of the conversation?
Similar to doctors and medical professionals, it's what's expected in that situation. So, for instance, we wouldn't expect somebody to show up naked to begin with coming into the examination room. That might be concerning for, let's say, in the psychiatry realm for active
That could be a problem.
or psychosis. So when we're showing up in those settings, part of it is what is the baseline expectation. If a patient always shows up a certain way, let's say they're always dressed a certain way, and now they show up very differently, that can raise an opportunity to ask with curiosity, but not judgment. And not curiosity being, oh, that's strange, but more so I'm interested in understanding because I care what's different today. Something that also I've learned, individuals who, let's say, are really struggling day in and day out to take care of themselves. They may actually show up more put together when they come to see you. But it's important for me to know what that typical day-to-day is looking like.
You might have somebody come in the office and they spent every effort of work for 3 or 4 hours prepping themselves. Maybe they haven't had a shower in a week, and maybe they were completely not able to do any basic daily living stuff. And they put all this effort. They come in all made up. They look super presentable. You would never even know if you saw them, out in public. You would never know they were having to come seek care at all, But if they weren't coming out to see you, they would not have gone through that process. Understanding that people can actually look better than what they're telling you is going on. And then at the same time, I'll meet people who they're seeing me in the midst of their workday. Maybe it's a car mechanic, maybe it's a farmer, and I don't take for granted they're coming in, carving out a very valuable piece of their time to see me. I don't expect them to change their clothes. I'm like, come in with your oil stains. It's fine. I'm glad you're doing your thing. And, people will oftentimes feel like a shame about it. I look at it as I'm just seeing a part of who they are. And so I feel like when it's a part of that realness of who they are, don't necessarily feel like you have to hide that, but also for us to realize people can look better than they actually are. I think those are 2 really important points about that.
That's one of those surprising things, because we might expect then if we're seeing somebody put very well together, everything's okay. And maybe part of what they're trying to say to us is, I want to feel okay, and this is how I want to present myself. We want people to be able to come in and feel that they can share authentically, this is what I'm experiencing. It's hard to help somebody and be able to find a way forward together if we don't understand what's going on. So one of the ways that we can do that as patients is feeling comfortable and being able to show up as our true self in where we are right now in this journey, whether it's I'm actively in the midst of work, I'm actively taking care of kids. The other thing we want to think about, though, is what's going to facilitate being able to get your needs met. So do you ever run in rheumatology with situations where the way somebody's showing up may get in the way of being able to help?
I feel like anything, when we're a patient, anything I can do to keep things efficient and keep my doc's mind on track is always a win. And I say that from the patient perspective. So I'll give you an example. If it's not a problem per se, but it's like a little good tidbit to keep in mind. If somebody's coming in and their only complaint is that their knee is really bothersome, it's pretty tricky that they maybe wore in skinny jeans. I'm not going to get that pant leg up above that knee. And it's not a big deal. We have, I like to call them the world's saddest paper shorts. And I'm happy to let somebody don those. We also have the probably one size fits none gowns, which I like to call them, which I'm sure patients appreciate both of those names that I've come up with over the years, but it's true. I'm true about these things. It's fine. It's just, it kind of breaks that line of thought. And even just, it's like I say, it's not a problem. It's just, I'm ready to go after this knee. And now you're going to break my line of thought. I'm going to leave the room, let you get changed. While I'm out in that sort of our main area, maybe my nurse has to throw a question to me about something because I'm out there. So here it comes, question about a different patient. Okay. Maybe a couple minutes later, I'm going to knock, come in, continue where I was. I mean, we get good at being able to, I can chew bubble gum and walk most days. I can multitask. But it's it really takes you out of the element when you could have just kept hammering at that point. So just being mindful, I think, sometimes of, like my favorite is somebody comes in, maybe they are wearing skinny jeans, and they'll say, oh, don't worry, I got shorts. There goes the jeans. I'm like, perfect. Let's knock this knee out. Let's see what's going on, not a break in the action, not a break in my consciousness or their consciousness about what's happening, and we just keep on going with things, you know? That's like a practical example.
It's less about like what you're wearing or the types of socks. It's about what our expectations are of one another, both as patients as well as physicians and medical providers. And some of that's going to change based upon the care setting. Some of that's going to change based upon the situation. When there's a difference from what we would expect, we want to find a way to ask about it in a way that's not shameful or causing judgment on both sides, both as a patient as well as a physician. Like if I see somebody coming in and they're very different from where they presented before, asking with care, what's going on? I'm interested to understand. The other thing is like looking at things that are really meaningful to that person. So let's say they have a tattoo or they have a necklace and they've shared with me something about a person that they've lost or a lived experience that they've had. It can be okay to share. Can you tell me more about that tattoo and what that means to me? Sometimes that bridge into being able to have a conversation and feel comfortable allows that person to reveal what ultimately is bothering them or be able to trust you with really important information that maybe they've not shared with anybody else before. How do you facilitate connection and trust when you're working with your patients?
I ask things with curiosity. I try to keep it warm. You know, I conversate with people like I'm sitting at their, the couch in their living room. That's how I try to, I think that's just how I am. But in doing so, that plus, having those bits of relatability that we can find over time and maybe learn that people are responsive to, socks or otherwise, can essentially get us to where we level some of that power imbalance in the medical setting and get it so that people can open up to us and feel like they can trust us with really sensitive information.
Although there's no studies on socks, there's some good information related to relatability and self-disclosure. So when we think about, let's say as physicians, what are situations where sharing a little bit about ourselves may be helpful? Let's say sharing a little bit about our personal situation or our lived experience with health. It's important that if and when we're sharing that, it's towards the benefit of the patient.
Yeah, I think meaningful disclosure to whatever seems to be the appropriate threshold for that given conversation may not much different than if you're meeting a friend, like a new friend or a new person that maybe doesn't know you that well. Like you might not disclose all of your deepest, darkest secrets of the family or something. For instance, I had a patient whose spouse passed away recently, and sometimes, depending on the scenario, it will feel appropriate that I might disclose some of the facts about, like, well, why do I know so much about bereavement? And I'll just mention something about Leon. Sometimes, like in this scenario, patients beside themselves, really crying, really needing a support phase. It's not about me, not appropriate to disclose that information, in my opinion, in that scenario. Still gave a lot of my sort of my take homes on like what were things that I saw that's kind of counter to the classic medical teaching on grief, like the fact that the 6-month grieving process is complete fake. It's not for grieving a loss. So it depends on the scenario. Other disclosures, more lighthearted. Maybe somebody has a mechanical joint pain. I mean, if it's appropriate, and I'm trying to convince them they need to do physical therapy, PT never works. Well, let me tell you, I've seen it where it does work, and let me tell you why, because I've had the same thing, and I can tell them about how that came to be, like whatever injury it was. I can talk to the anatomy and why it works the way it does, and kind of get that person, maybe through a personal anecdote, maybe at least get them on board for what ultimately needs to happen.
When sharing those parts of ourselves, it's important in those small doses, I think. And so if we're not sure how much to share, erring on the side of sharing less can be helpful, because what we don't want to do is take away from the focus being on the patient. Just like what you're sharing, it's about finding that level of how much we're going to share about ourselves. When we're thinking about whether it's socks or whether it's the way that we show up with communication, it's all about that connection. And it's all about how are we relating to one another, because trust ultimately is what is the foundation that's needed if we're then going to be able to move forward with understanding and then finding a way forward for medical treatment, for health, and for well-being.
The most important is it's not even just appearance per se that matters. It's really more your approach to the entire interaction, how you put forth everything from tonality to how you ask questions to just how you're sitting, body language. People notice body language first thing. Appearance comes as part of that in context, but that's almost like supplemental to that sort of base of your general approach and demeanor.
How, as a physician, can you maybe evolve? I want to try out having some socks, or try out how I can show up uniquely to help my patients feel comfortable. What would be some of your recommendations?
I would say, honestly, number one, pay attention. Like, pay attention to how patients respond to different things that, you know, again, I don't know why it's always bow ties, but bow ties always come up. And some people wear them awkwardly and some people wear them very unironically and look fantastic. Um, if you notice, like, weird, yeah, I wore this bow tie and people really liked it. Like, maybe you should like dig into that. Like, do a once a week thing, like every Thursday. That's what I'm gonna do. Like, pay attention. Pay attention to the folks you work with too. I mean, they'll also send you signals if things seem off. I mean, if you're perceptive to it and you notice it, maybe there's something to that.
I think that gives a way forward for patients too. So try out sharing some feedback, especially if there's something that you like about the way your medical provider or your physician shows up, because you never know how that might evolve in terms of a better way of relating to others. And it's also important that you show up in a way that you can communicate best what's most important to you. So think about that with your dress. Think about that in terms of the complaints or the concerns that you want to bring to the table. The other thing is, as a patient, it's really important you let us know if something isn't working well too. And doing it in a way not of shame and judgment, but of more rather, this is very important to me. It helps me when a doctor does X, Y, and Z. Or I noticed that when we were talking about this concern, I didn't have a chance to fully share what I'm experiencing, and giving that opportunity for the relationship, because it's dynamic. It's not, do you bring in the socks or do you not? Do you bring in these concerns or do you not? There's an opportunity through the relationship. And I think the other part is, if it's not working well, like let's say we're just really not jiving, we've tried to engage in different ways, it's also okay to get a second opinion or try to find a better connection with another medical provider. Because what we know is, even more so, do you like the person's socks or do you not? Trust is a foundational part, even more so than what are the objective pieces of competency. It's important, regardless of the level of knowledge and the level of experience, that we have trust and the ability to, especially with difficult care needs, be able to move forward together.
How can we do all the above, talking about socks or talking about, smile here or this is how we should sit? How can we do that and not come off as being very calculated or overly calculated?
I think part of it is, what's the intention behind it? So are we just wearing these socks to try to kind of put on the uniform, or are we putting it on because it helps us to better connect with our patients? So thinking about, what's that intention behind this. It's okay to feel awkward with some of these things. You and I, for instance, on this podcast, we're trying out what it feels like to be having a camera on us and having a microphone. That's something that we're not used to having. So I think part of it is it's okay to try out different ways of relating and to see what feels right as we're doing that and as we're getting that feedback. However, if we're purely doing this to set up sort of a production or to be something that we're not, patients are going to feel that. And so it's important to take those cues both from other people and then also within ourselves, what's feeling authentic. For me, an Argyle sweater as a psychiatrist just doesn't feel like it fits. I could try that on.
I appreciate that.
I could do that. It just wouldn't feel aligned with me feeling comfortable. It would be scratchy or, it wouldn't feel like that is authentic to me. So I think it's less about getting it right every time. It's more about leaning into what feels right, what's the response from others, looking for that feedback, not as much for approval or validation, but more so constructive feedback to be able to find what is sort of the way that I want to show up. This is going to be harder for new practitioners than this is going to be for experienced, because you're going to learn by doing. You're going to learn from all that feedback that you get. So it's okay to be learning as patients and physicians. It's okay to be trying out what feels right, but be responding to that input and don't feel like you need to be representative of that just because that is the only way.
I think if you keep in mind that the point of everything we're talking about is not eliciting a response. And again, it's like the disclosure piece. It's not about us. But bringing it back to the point of noticing these things, like how we connect, how we present and all that, it's about making that connection as opposed to eliciting a response. And so I'm just going to wear my socks. And if they get a response, great. But I'm not wearing them for that purpose. Honestly, I'm going to wear them till they have holes in them, and then I'm going to get a new pair and keep going the same way. If you enjoyed being part of this conversation, be sure to like, subscribe, and give us a follow. If you have any questions, topics for future episodes, or a no-cure moment of your own, be sure to leave them in the comments. Thanks for listening, and see you next time.